Good morning. I'm Doneen Day, the coding educator for the Surgery Pod, and I'm going to be speaking to you today about ICD-10 updates for effective October 1st, 2016. This is oral surgery, and we don't have a whole lot of codes, but I'm going to go over the few that we have. Unspecified codes. The Center for Medicare and Medicaid Services allowed a one-year grace period to adjust to the new coding structure regarding the usage of unspecified codes. However, that year is up, and CMS will now be expecting physicians to document and code with a high level of specificity for the conditions that fall within their specialty. Effective 10/1/2016, unspecified codes will not be accepted for conditions that fall within a provider's area of expertise. Some tips from documentation include update your problem list to the most current specific diagnosis and remove duplicate or conflicting diagnosis.
I'm not sure I understand.
Document according to acuity and the highest level of specificity. Document cause and effect relationships as well as linking complications to chronic conditions. Probable and suspected conditions should be reported as signs and symptoms until a definitive diagnosis can be made. New code is pulpitis. These codes are described as reversible and irreversible. We had pulpitis, but we didn't have the reversible and irreversible. Periodontitis. We've had aggressive and localized and aggressive and generalized, and now these codes want to specify the severity as slight, moderate, severe, or unspecified, which of course we don't want to use unspecified. And the same thing for chronic periodontitis. We always had localized and generalized. Now we have the severity, slight, moderate, or severe. They've added horizontal alveolar bone loss as a code. We didn't have that before. Unsatisfactory restoration of teeth. We've had a few codes for that, but they've added a primary occlusal trauma and a secondary occlusal trauma. Facial fractures. The only change here is that they've added laterality. Just be sure to specify exactly where the site is, and especially with the mandible where we have so many locations. I did want to remind you all of the 7th character that's required for fracture codes. A is for the initial encounter. B is for the initial encounter for open fracture. A was for a closed fracture. D is going to be the subsequent visit for a routine healed fracture. And then we have G for a subsequent encounter for a fracture with delayed healing. K is subsequent encounter for a fracture with non-union, and S for sequela. And then these are some unspecified codes that we are currently using that Medicaid has not been accepting the unspecified codes, and so we're not getting reimbursed when we use these codes. Effective 10/1, Medicare will not be accepting these codes either. So we have the M1990 unspecified osteoarthritis unspecified site, and K02.9 is dental caries unspecified. So for M1990, these are some suggestions. Other specified disorders of the temporomandibular joint, other specified disease of the jaw, and arthralgia of the temporomandibular joint. I did go to the conference last week and spoke with a surgeon and asked him about what he uses. He was presenting at the conference, and he uses the arthralgia of the temporomandibular joint. So I don't know if that might be, which option might be best, but we cannot use that M1990 for unspecified osteoarthritis for an unspecified site. And then dental caries. We have options for dental caries. Our documentation should be saying whether it's penetrating into the dentin or the pulp, or if it's a dental root caries, so that we can use the proper diagnosis code. That's all I have. Please feel free to contact me with any questions or concerns. I'm usually available. Thank you for your time.